Hello everyone. This video will help you to learn more about assessment of dehydration in children. I am Dr. Celeste Mary, Vice Principal in Administration at Triplum College of Nursing. Objectives. By the end of this session, learners will be able to define the term dehydration, list the causes of dehydration, and understand the types of dehydration based on severity and amount of fluid loss, explain the pathophysiology of dehydration, and able to discuss the clinical assessment of dehydration, and list the possible complication, and discuss the treatment and nursing management in dehydration. Introduction. Water is an essential element of the body. Up to 75% of the body's weight is made up of water. Most of the water is found in intracellular space, extravascular space and interstitial space. Children are more prone to dehydration due to acute gastritis or other illnesses such as vomiting, diarrhea and fever. Considerable care is required in assessment and management of dehydration in children. Moving on to the definition, dehydration is defined as an excessive loss of body fluids and electrolytes. It results from decreased intake of fluid, increased output of fluids from the body and shift of fluids, or maybe the capillary leak of fluids, like example burns and the sepsis. Next, we can see about the causes of dehydration. The conditions like gastroenteritis, vomiting, excessive sweating, mouth ulcers are like stomatitis, pharyngitis and tonsillitis. The pain may severely limit the over intake, and heat stroke, febrile illnesses. This causes the increased insensible fluid loss, and diabetes child and burns. The fluid losses may be extreme and require aggressive fluid management. And about the excessive blood loss caused by trauma or accident. These are the causes of dehydration. Next, we can see about the types of dehydration. It can be based on types of fluid loss or maybe based on severity of fluid loss. So first one is the based on type of fluid loss: hyponatremic, hypernatremic, isonatremic. Hyponatremic means loss of electrolytes, particularly the sodium, less than 135 ml, and hypernatremic means loss of water and sodium more than 158 ml, and isonatric means equal loss of water and electrolytes. And types of dehydration based on severity, it can be classified as mild, moderate and severe. Mild condition when the fluid loss reaches the 5% or less, or moderate fluid loss severity condition is when the total fluid loss reaches to 5 to 10% of body weight, and severe condition is when the total fluid loss reaches more than 10% of the body weight. It considered as an emergency condition. Next, about the pathophysiology of dehydration or mechanism behind this. The decreased intravascular volume, so that it decreases the venous return, and it causes the decreased ventricular filling, so it leads to decreased stroke volume. By that, the decreased cardiac output will be occur. By that, the inadequate tissue perfusion will lead to dehydration. Next, we can see about the clinical assessment of dehydration or clinical features of dehydration. It can be classified as mild, moderate and severe. First category is mild dehydration. The signs and symptoms are the child will be not dehydrated, and child will have severe thirst and consciousness, and the body weight will be lost less than 5% in children. Moving on to signs and symptoms of moderate dehydration, the child has the clinical features of dry skin and mucous membrane, thirst will be there, decreased urine output will be present. When the child cries, the tears will be present, muscle weakness will be there for the child, drowsiness and light headache will be present, shrunken fontanelles will be visualized, and decreased blood pressure, increased pulse rate will be there, shallow rapid respiratory rate, and 5 to 10% the body weight will be lost for the child. These are the clinical features of moderate dehydration. Next, about signs and symptoms of severe dehydration. The child will have extreme thirst, very dry mouth, skin and mucous membrane, shrunken eyes and fontanelles. When the child cries, no tears will be present, rapid heart rate and shallow breath sound, and the child will be unconsciousness, and more than 10% of body weight loss will be present. Delay capillary refill for more than 2 seconds. These are the clinical features of dehydration in children. Next, we can see about some of the possible complication in dehydration. Because of severe dehydration, brain damage can occur, seizure, hypernatremia, hyponatremia, hypovolemic shock, kidney failure because of the inadequate tissue perfusion, coma and death. These are the complications in dehydration in children. Moving on to the treatment, it depends upon the age of the child, weight, severity of dehydration and its cost. First is the oral rehydration solution. ORS is used for mild and moderate dehydration. It can be a packet form or homemade form. Intravenous fluid replacement is a vital role of treatment and treating the underlying cause of dehydration, and can be administered the medication for vomiting and diarrhea. Next, we can see about how to estimate the maintenance of fluid requirement for the child in hourly basis or daily requirement of fluid. Here, if the child weight is less than 10 kg, the daily 10 ml per kg per day it is required, and 10 to 20 kg 1000 ml plus 50 ml per kg per day the fluid is required, and more than 20 kg the 1500 ml plus 20 ml per kg per day for every day the fluid requirement. That is the holiday cycle and 4-2-1 rule formula. Finally, moving on to nursing consideration, assess the vital signs, preferably noting the peripheral pulses, and monitor the intake and output chart and maintain the IO chart. Observe the physical properties of the urine. Correctly infuse the right amount of intravenous fluid for severe dehydration. Encourage small and frequent feeding for children and provide the skin care. Administer medication as prescribed. Thank you.